Welcome back to our second session, and this session is going to be on diabetes medications. Again, my name is Kimberly Boone, and I am the dietitian here at Church Health. A little bit of review from the first session. Diabetes is controlled by three main things: medications, nutrition, and exercise. So today's class, we're going to be focusing in on the medication portion. Medication is a key piece of managing your diabetes. What do you think can happen if you don't take your diabetes medication or insulin as prescribed? So you could have blood sugars that are very high, very low, could be all over the place, and we don't know what our blood sugars are doing unless we are checking those blood sugars and taking our medications accordingly. Diabetes medications work in various different ways. They could help your body to make more insulin, for example, or they could help your body the insulin that it is producing could help your body to use that insulin better. It could also keep your blood glucose from going too high after meals. So again, those are diabetes medications such as pills or injectables. You can think of them as greasing up those locks. So remember the rusty locks from the first example. So they could be greasing up those rusty locks to help your body do these things and to use the insulin better. However, these are not insulin. So there's medications such as the pills or injectables. They're totally separate from insulin. These are some common diabetes medications that we have here in the clinic: metformin, glipizide, Victoza, Januvia, glypiride, Byetta, glimepiride. All of these things are different types of pills or injectables. Metformin is the one that I would say most people are familiar with. It's very common, and again, it helps to grease up those rusty locks. It helps the insulin to get the sugar into the cells better, and it helps the liver not to make as much sugar. So as you can remember, if there's blood sugar in your blood but it can't get into the cells, what's going to happen is your liver is going to compensate for that, and it's going to start spitting out sugar, and it kind of tells the liver to halt and not do that as much. One side effect of metformin is you will tend to lose weight sometimes. That can happen. It's usually the first type of medication that people are prescribed whenever they're first diagnosed with diabetes. Victoza and Byetta, those are injectables, and what those do inside the body is they tell your pancreas to make more insulin so it keeps the blood sugar from spiking so much after meals. It also helps to slow down digestion in the stomach, and it helps you to get fuller faster and fuller longer, staying fuller longer, and can sometimes also cause weight loss. Glipizide, glypiride, and glimepiride, those are pills, also very, very common to work with, and they work by increasing insulin production and can cause weight gain and low blood sugars occasionally. Jardiance and Invokana, those are also pills. They're not mentioned on this slide, but they're also very common. They work by blocking the reabsorption of sugar by the kidneys, and it's therefore excreted in the urine. So because of this, and because sugar is being excreted in the urine, it can put you at higher risk for developing yeast infections or UTIs. A lot of the times though, the benefits outweigh the risk for all of these medications, and they can really help to control those blood sugars. Now, insulin is completely separate. Insulin is a hormone, it's made by the body, but can also be given as an injection. Remember, insulin helps to unlock those cell doors so blood glucose can enter. But there are different types of insulin, a various amount of different types. Most people just say insulin, but they don't realize there's different types of insulin. So the first is rapid-acting insulin. Those begin working very quickly, usually within 15 minutes or so, and those cover the carbohydrates that you just ate in a meal. This is also called mealtime insulin or corrective insulin at times, and it can usually last anywhere from 3 to 5 hours. Some examples of those rapid-acting insulins would be something like Humalog or Novolog or Apidra. There's also intermediate-acting insulin. Now this insulin looks a little cloudy in color, and you can also get this insulin at something like Walmart, over the counter, a lot of people don't realize. And it goes to work in 1 to 2 hours, and it can last anywhere from 12 to 16 hours. Usually this is dosed at about twice a day, before breakfast and then again before supper. Some examples of these types of insulins would be something like Humulin N or Novolin N. Then there's a long-acting insulin. So these work to keep the blood glucose level throughout the day normal. So it's a little bit at a time, and they can last up to 24 hours. These are usually only taken at dose once a day. Lantus, Levemir, and Toujeo are examples of some of these long-acting insulins. And then there's a mixed insulin. So these types of insulins have two different types, usually a rapid acting mixed with a long acting in one, and that way you're not having to take as many injections throughout the day. They work to decrease blood glucose after eating, and they work to keep the blood glucose level throughout the entire day. Again, doing the action of those two types of insulins all in one. So something like Humulin 7030R or Novolog 7030R are examples of these mixed insulins. Now there are several rules for using insulin. Make sure you are injecting the right type of insulin. This is especially important if you're taking more than one type of insulin. You don't want to mix up your short-acting insulin with your long-acting insulin. Again, that could potentially lead to a dangerous case and could land you in the hospital. Only use your own insulin. So again, this is important to know that there are different types of insulin. So if you've got a friend that's on insulin and another friend that's on insulin and you're maybe out of insulin and you want to borrow theirs, their insulin may be a completely different mechanism of action than your insulin. So you want to make sure that you're only taking your own insulin, and always call your provider or pharmacist before making any changes or if you have any questions about your insulin medications. Sickness. So if you're sick, that can lead to an elevation in your blood glucose. It could lead you to have hyperglycemia. So it's important to know what to do on sick days. And there's an acronym for this. SICK, very convenient. SICK, the first S stands for sugar. So sugar meaning check your blood glucose more regularly than normal. So sometimes, generally speaking, we say every 2 to 4 hours while your blood glucose is elevated or until symptoms subside. You're also going to want to take your insulin and medications as usual. So don't stop taking those just because you're not feeling well. And call your doctor if you have a fever or if you vomit more than once. Definitely call your doctor. You're also going to want to drink lots of fluids and stay hydrated, and try to eat as normally as possible. That's where the second carbohydrates come in. So carbohydrates meaning the foods that you're eating that contain carbs, making sure that you're eating as normally as you would, even if you're sick and you don't feel like it, especially if you're taking those types of insulins that are banking on the fact that you're going to have carbohydrates in your system. And K stands for ketones. You're going to want to check for ketones if your blood glucose is above 250. Again, the ketones is your body's way of getting fuel. It's going to break down those proteins and those fats because it's not able to do so with the blood glucose from carbs as efficiently. And we covered that in the first section. And if you would like to get more into that, you can watch that again. If your blood glucose is higher than 250 and you do have moderate or large body ketones, you're going to want to call your doctor. So let's review for this second part of the series. A little bit of repeat from the first part. Diabetes is managed by what three things? Medications, nutrition, and exercise. What are those blood sugar goals? So a fasting or before mealtime goal should be anywhere from 80 to 140. And after meals, your blood sugar should be anywhere from 140 to 180. These are general numbers, again, individualized per person. And what are the rules for using insulin? Making sure that you're using the right type of insulin, double checking to make sure, triple checking to make sure that you're using the right type of insulin before injecting yourself. Only using your own, and always calling your provider or pharmacist before making any changes. Do not try to self-medicate. Also call them if you have any questions to do with your insulins. Thank you for watching the second part of our series. Continue on, and we're going to talk about nutrition and exercise in later classes.